What's up, guys? Welcome to Health Economics Classes 101 with the one and only Ken. So, today we're going to discuss about determining the causes of high cost of healthcare. Okay, so let's start this presentation. This is the presentation outline. So, today's discussion will cover two parts discussed here: identifying the contributing factors to high cost of healthcare and knowing how to control the cost of healthcare. So, let's start. Let's first discuss what makes healthcare cost expensive. First thing we should think about is the process behind this. The process behind production, manufacturing, and research sure is costly. So drug development research funds usually cost millions of dollars and in pesos, billions. So next, we've listed down a few factors on the reasons why healthcare cost is expensive. So these are some. First, it uses expensive new diagnostic tests and treatments for research. Second, the marketing of these new drugs, devices, and procedures. Next would be the overuse of specialists and high administrative cost. And lastly, insurance. Okay, so let's elaborate this stuff. First, uses expensive in new diagnostic tests and treatments. This is where the thing I said first about this uh, lesson would be. The cost of research and production is equal to the cost of product once they are sold in the market. So, you don't want to start a business na ang itithink of mo is yung capital mo and kung ibebenta mo na siya right at the market, malulugi ka. So, you just set it at a price wherein nababayaran mo yung cost of capital and sa revenue and profits mo, meron kang net na tubo. So next, marketing of new drugs, devices, and procedures. This one also falls under sa cost of research and production. So, as ito naman, separate account statement. So, say that. They allot budget in this too, sabi dito. How do you expect this to sell out if they don't get advertised? Imagine you selling your product without actually trying to sell it out to those customers in the market. Imagine not having ads, not having commercials, and not getting the exposure that your product needs. Expect that it won't sell out. So what do? You market it. Next, why is healthcare cost costly? Another thing is overuse of specialists. So let's say you have been treated with bone cancer. And first, the hospital suggested you to go to a cancer primary care doctor. But you have bone cancer. And what if this cancer primary care doctor doesn't know anything about cancer in the bones? You go to bone cancer specialist. This is called narrowing scopes. Specialists treat more and certain and particular diseases compared to primary care doctors. So let's just say that we've tried to contact specialists to do their special and particular jobs rather than primary care doctors who could, try to solve easier cases. But when things come to the rough edge, you call these guys. And I tell you, this is not something you can't afford easily. The amount of work and studying they have put in their specialties is far greater compared to those serving as primary care doctors. Here's a few more. Next would be high administrative cost. This is the situation. Imagine a hospital being run by doctors only. No staff, no employees, no guards, etc. They expect a hospital to run like that. If it gets robbed, what happens? Who does the paperwork? Who gives the doctors their professional fees? Sinong nag-aasikaso ng PhilHealth? Sino nag-aasikaso ng medical insurance ng patients? You need those people who knows how to run those things. Doctors don't know really how. So they need help. A hospital is not run solely by doctors. You need those type of people. Last would be insurance. So we're talking about uh, what if you went to the hospital to get treated, but what happens when it gets worse? Doctors also go risk when doing treatments. In insurance, this is where malpractice costs come in. So if anything na try mong ipa-check sa doktor and they try to solve it but they couldn't have done it and ang nangyari is things got worse, don't mind. They're the ones who is responsible for that. And this is why healthcare cost is expensive. A portion of the things you pay also comes here. But don't mind if ever na ikaw man ay masubject into a doctor's malpractice, you're also subject to having your fees paid by them. Okay, so now, how do we control the cost of healthcare? We've listed down a few steps on how. First, ito yung mga factors kung bakit nagpa-fluctuate up and down ang cost ng healthcare. First is how much people use healthcare services. Next would be how much providers are reimbursed for their services. And lastly, what is the total cost of running a healthcare business? Now, how do you reduce your expenses for healthcare? First, don't ask for healthcare services unnecessarily. Sabi dito, the little symptoms don't always necessarily equate to the bigger disease. Except in this type of pandemic. When you feel that you are sick, right in the nose, colds, right in the throat, cough, or those things that you think you got it when you went outside, I tell you, get tested. Don't risk your family's health. Next, don't get sick. Yes, don't get sick. Invest in healthy and nutritious food. Invest invest in healthy vitamins and minerals. Because I tell you, the things you invest in those kind of stuff, the things you invest in having your health in the line is far less expensive than the ones that will cost you once na hospital ka. So lastly, get insured. This is your health savings account. When time comes, you get unhealthy, catch a disease, or even get into an accident, being ready pays far more than you could ever imagine. So the thing is, kung Pinoy ka, and if you're working, try to get insured by PhilHealth or other insurance companies. Because you'll know when the time comes, the things you sow, you shall also reap. So thank you for coming to my crash course. This is your boy Kin, signing out.